Earlier this month, the U.S. Preventive Services Task Force released new guidance for breast cancer screenings. And Dr. Jennifer Yilk from Dooley Health and Care joins us this morning to explain how this will impact women. Dr. Yilk, thank you for being with us.
Thank you, Michelle. Thank you for having me.
Of course. So the new guidelines say women with average risk should be screened every other year starting at age 40 instead of age 50. So who would be considered average risk? Let's start there.
So average risk is most women. I know breast cancer is 1 in 8. However, average risk is 40 and above. And the National Task Force, although I'm applauding them for bringing down the age down to 40, they're recommending every other year. And what we follow is the American College of Radiology, which is 40 and above, and every year after that.
Has any information been released on why they thought it was important to make this change?
I think initially when they had it at 50, they were really worried about too many false positive rates. However, if you go to a reputable institution where most people are fellowship trained, those false positive rates are actually minimal. So I think they're starting to realize that there's more and more specialized radiologists going into mammography, bringing down that false positive rate, hence bringing it down to 40, which we applaud.
So who would be considered in the high risk group, and then does that mean they need to get screened even earlier than 40?
Yes. So high risk, there's many, many factors. We have a lot of minorities we do consider high risk. They present at a higher stage. Ashkenazi Jews, they have the prevalence of having BRCA1 and BRCA2. And then we also have a Tyrer-Cusack algorithm that we do here at Dooley to predict whether somebody's going to be high risk. On top of it, they also have density. We've been talking about density 3 and 4, which is heterogeneously dense or extremely dense. Those women we also consider high risk because mammogram can only go so far. So we do recommend that those women get screened with alternative screening, such as ultrasound or MRI.
All right, all important information and factors to keep in mind. Dr. Yilk, Dooley Health and Care, thank you so much again for being with us this morning.